come in.
Hello, my name is Terry. I'm going to come in today and do a couple of assessments on you. I'm going to go ahead and provide myself some hand hygiene, provide us with a little bit of privacy.
Okay.
Can you go ahead and verify your name and date of birth for me?
Yes, Kanasia Thomas, May 29th, 1999.
Okay, can I verify that with your arm in?
Mm-hmm.
Okay. So, Miss Kanasia, I have come in today. The doctor has ordered a couple of assessments on you.
Okay.
Today we're going to be doing a multiple skeletal, a hint, neuro, cardio, respiratory, perla, and checking to make sure everything is safety for you, okay?
Okay.
So we're gonna start off with your musculoskeletal. Are you experiencing any arthritis?
No.
Any joint stiffness?
No.
Okay, no joint stiffness or anything? Okay, so what we're gonna do is I'm gonna go ahead and do range of motion on you.
Okay.
So what I want you to do is put your wrist out, your hands out. So this is flexion,
Okay.
this is extension,
Okay.
and then hyperflexion. Hyperextend.
Okay.
Okay, put them back down for me.
Mhm.
So what I want you to do is press down on my hands. I'm just checking the strength.
Okay.
Do the same thing with this hand.
Mhm.
And I want you to press up.
Okay.
Okay, do the same thing with this hand. Okay. And we're gonna also test for your range of motion in your elbows.
Okay.
So I want you to do like this. This is flexion,
Okay.
and I want you to do extension.
Okay.
So while you're in extension, I want you to try to press up on my arm.
Okay.
And I also want you to press down.
Okay.
Press down for me.
Mhm.
Okay, so everything looks good with that. And I'm also gonna check two of your lower extremity, okay? So your knees, if you just put them down like that, that's flexion that you're in right now.
Okay.
And then I want you to extend, okay? Do the same thing with both legs.
Okay.
Push right there. Okay, can you push forward or apply some pressure?
Okay.
Same thing.
Mhm.
And can you do that backwards for me?
Okay.
Okay. And I also want you, we're gonna do your feet. I want you to do flexion.
Okay.
Now I want you to do plantar flexion, which is that one.
Okay.
Okay. And can you press up?
Mhm.
Okay. And just continue pressing down.
Okay.
Okay. Do the same thing with this foot. Up
Mhm.
and then down. Okay. So also, I'm gonna do what I call is a hint assessment,
Okay.
and I'm just gonna be checking for hair loss. Are you experiencing any hair loss?
No.
Any lesions at this time?
No.
Okay. Any eye drainage?
No.
Any ear drainage?
No.
Are you having any difficulty swallowing?
No.
Any difficulty hearing?
No.
Do you wear glasses?
Yes.
Okay, you do wear glasses. I do see them. I do apologize for that. No offense. Also, can you tell me where you are right now?
Yes, I'm at school.
Okay. And do you know why you're here?
Yes, I'm having some chest pain.
And can you tell me who the current president is?
Donald Trump.
Donald Trump. Can you tell me today's date?
Yes, it is 9/11/25.
And patient is already at times 4. They know she knows her place, where she is, and her surroundings. She's able to comment back to all the questions that I'm asking her. And have you had any brain injuries?
No.
No brain injury. Have you had any dizziness or balance changes lately?
No.
No to all of that. Okay, so what we're gonna do right now, I want you to put your finger on your nose.
Okay.
But you touch your nose papacy. Breathe in. Do the same thing on the next side. Okay. And I also am gonna check your mouth.
Okay.
And while I'm checking that, I just want to use this light once. So I'm gonna check also for your ears. Just make sure you don't have any drainage.
Okay.
Okay. No drainage in your ears. Okay. And I'm just gonna look at your pupil size.
Okay.
So I'm gonna put this light into your eyes. And I'm gonna do the same thing on this side. Let's follow this pin light, okay?
Okay.
So I'm gonna go to this side. Around, we're adding to light and accommodation.
Okay.
Your eyes does not constrict. Also, I'm gonna check your mouth.
Okay.
And can you just say ah for me?
Ah.
Okay. So long as moist and intact, and you say you're not having any, or you having any difficulty swallowing?
No.
Okay. And I'm gonna also check you for JVD.
Okay.
No JVD present. I'm gonna check the other side. No JVD present. And I can also check your carotid artery here
Okay.
if I wanted to. In other places I can check your arteries would be, like I said, this would be your carotid. I can check up on your axillary. I can check in your brachial.
Okay.
I can check in your radial.
Mhm.
I can also check in your femoral. I can check in your popliteal, which is behind your knee.
Okay.
I can check your dorsal pedis,
Mhm.
and I can also check in your posterior tibia.
Okay.
Those are different places I can check your pulse. And also I can check your apical pulse, and if I heard any irregular breathing, I would check your apical pulse for a full 1 minute, okay?
Okay.
So what I'm gonna do right now is just go ahead and start with the cardio. And are you experiencing any chest pain?
No.
Any shortness of breath?
Well, I'm sorry. Yes, I am having chest pain. That's why I'm here.
Okay, you having chest pain? And on a scale from 1 to 10, how would you rate that chest pain?
A 5.
And is this new?
No. It's been going on and off.
Been going on and off. Are you experiencing any swelling?
No.
Okay, I will check that too, and I will get that notated to the doctor. And are you having any shortness of breath?
No.
What about for, are you having any coughing?
No.
Okay, any event that you did have any coughing going on, we will teach you what we call the turn, deep breathe method. So you will cough, turn, and then deep breathe, and that can help you get rid of any sputum that you have. And we also have what we call the incentive spirometer. The incentive spirometer, what you would do with that is breathe in it 2 to 5 seconds, 2 times every hour, okay?
Okay.
Okay. And also, I just want to let you know for your surroundings, I know you said you having chest pain. What did you say about dizziness?
No
No
distance.
dizziness. Any event that you were having any dizziness or any, anything abnormal in your home, just make sure everything is safe and, no clutter, rugs, anything, all that is out of the way. You don't have any clutter around you. Make sure if you use a cane or walker, any type of assistive device, it is in reach. And you can also use a table to keep all of those items on, like your cell phone, your call light if you're in the hospital, to make sure it's in reach.
Okay.
So now I'm gonna start with your cardio.
Okay.
So this is your aortic. And I will hold up your breath, mitral valve, and I can also check your apical pulse here, like I stated earlier, and I will listen for 1 minute for any heart murmurs, anything that I hear, any abnormal sounds,
Okay.
anything of that nature. And while I have that part complete, I'm just gonna go ahead right now and listen. Look for check for capillary refill.
Okay.
I'm also gonna check for edema.
Okay.
I'm gonna do the same thing on both hands. I'll check for edema in your lower extremity.
Okay.
I'm also gonna check it for skin tinting to
Okay.
make sure your skin recoils immediately, okay? And it does. And you can check on anywhere that you see like loose skin. You can also check up here in this area right here for skin tinting to make sure your skin bounces back.
Okay.
And that you're not experiencing any dehydration or anything like that, okay?
Gotcha.
So what I'm gonna do now is I'm gonna go into your respiratory, and I'm gonna listen to you breathe, okay? You can just breathe normal. Whenever I touch you, just breathe in and breathe out, okay?
Okay.
Right upper. Left lower. And I'm also gonna check on the side. Okay, you can breathe out. And I'm gonna also check posteriorly, okay?
Okay.
So this is your right upper.
Okay.
Left upper. Left lower. And your right lower. Okay? Hey, I want to ask you also, do you have any allergies?
No.
You don't have any allergies?
No.
And, when I checked for your range of motion, I did not hear any crepitus or anything, any crack. And if I did note any crepitus or hear any crepitus, I would get that notated for the doctor. Anything else you would like for me to inform the doctor about today?
No, ma'am.
Okay, and one more other thing, I want to check your teeth. Are you missing any teeth?
No.
No teeth, pretty smile, no dentures?
No.
Okay, so I will get all this documented for the doctor and he will be in with you shortly, okay?
Okay. Thank you.
You're welcome.